I want to talk a little bit more this week specifically about stress and anxiety because we all know that stress and anxiety have negative impact to pregnancy, to fertility. And one of the most important things to decrease stress and anxiety is to be able to identify what is actually triggering the stress. What is causing you to feel anxious? So in cognitive behavioral terms, we use the ABC model. A stands for antecedent, B stands for behavior, and C stands for consequences. So what does this mean? Well, antecedent is identifying what exactly are the triggers. What is causing you to behave in this certain way? And if B is the anxiety, is your reaction to whatever the stressor is, then C is the consequence. It's the negative hormones that are affecting your pregnancy or fertility. So it's important to recognize this formula, the ABC model. For example, this week is definitely a stressful week for us because this is when we have to make a decision of whether to do the CVS or the amniocentesis, both of which are invasive procedures to determine whether there are genetic or chromosomal abnormalities with the babies. Now, the benefit of doing that is that you know ahead of time if you're keeping the pregnancy. Should there be a genetic abnormality, then you can prepare ahead of time. And for us, it's important to know this because if one of the babies have a genetic abnormality and if we choose to terminate that pregnancy, then we have a very small window to do so without affecting the other baby. So this is a very stressful period for us. And what I have had to do is recognize what was causing this anxiety that I was feeling, especially these last few nights. And when I identified that it was this decision of having to determine whether we want to go through this procedure, and if so, which one? The CVS, which you can detect earlier, though it has a slightly higher rate of miscarriage, or the amniocentesis, which we can do later and has a lower rate of miscarriage. So recognizing that this was the antecedent to my stress and anxiety this week, I was able to prepare for it. I was able to do something about it. For me, it was important to gather the right information. It was important for me to speak with specialists that I respect, who can give me factual information on the best course of action. And once I got that information, and once we made an informed decision, it was that pressure of having to make that decision that was causing the stress and anxiety was so much more reduced. Now that doesn't mean that there's no stress or anxiety to come with actually going through the procedure. And if we choose to do that, then that's something that I'll be experiencing at that later point in time. For now, it's one step at a time, and this is what I'm dealing with this week. So this is your baby steps to a stressless pregnancy.